locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show for Tuesday, May 26, 2020, our last Tuesday here the month of May. And we're going to be joined by Dr. Natalie Sohn. She's an OBGYN, and she very experienced, a lot of areas of interest. Hi, Dr. Sohn. I see you there. So how are you doing this evening?
Hi, David. Doing well.
Thank you. Yeah, with all that's going on. And thank you for joining us on this adventure of health. So I wanted to ask you, because you see a lot of patients, I want to see how things are going with different doctors. Have you found that patients are now scheduling or keeping their OBGYN appointments, or has it been a little different? What's kind of the landscape out there?
Things have improved over the last week and a half, I'd say. Before that, nobody wanted to come in, or, they just wanted their prescription refilled, for example, and then they'll say they'll come in a month or two when things blow over. But all of a sudden, things sort of, once they opened the beaches and did the phase 1 opening of South Florida, more people are coming in. It's not what it was, but certainly I see people being less afraid to come to the doctor.
Well, that's good news. As things open up, things are changing. So we're on here on the radio, and we're also on video. Dr. Sohn, if you have a laptop or whatever, if you just tilt it a little bit, you'll be able to. There you go. Yeah, because we're on both platforms. Last time I interviewed you, we were at a remote location and not in studio a couple years ago, and then here we are today with all that's going on. And hey, but I just thank you again. I've been doing this for 10 weeks from the home office, and we've got a lot done, had a lot of doctors on, so we always appreciate the insight. I wanted to also ask you, because I know a lot of doctors are doing telehealth, and a lot of them may not have been doing telehealth beforehand. What's the story for your practice? Are you available telehealth as well?
Yes, we're doing telehealth. One of the main types of patients we'd see via telehealth would be somebody that needs to get results over the phone and have a discussion about them. Sometimes we can also do prescription refills. For example, if we're seeing how somebody's reacted to a medication instead of a follow-up visit, we can definitely talk to them just like you and I are talking, and then refill their meds. So it's not a lot of patients for what we do, because OBGYN is mainly hands-on, but certainly over the last few weeks we've expanded our telehealth so that now I'm seeing a few a day, a handful at least.
Hmm. And that's great. We're here with Dr. Natalie Sohn. So yeah, so screenings are still need to, most of them need to be done in office. Now, let's talk a little bit about, one of the things that I've said during this whole pandemic is, hospitals and doctors' offices are some of the cleanest places I've ever been. You and your your peers in that field have always been wearing gloves, have always been using masks, and as well as the hospital setting as well. So take us through a little bit of the safety and protocol, because everyone asked that about the office and then the hospital as well.
We are doing social distancing in our office, which means patients are sitting 6 feet apart. If patients want to wait in their car before their appointment, they're given that option. So then we'll call them and they just come in so they don't have any contact to anybody else in the waiting room. Everybody is wearing masks, all the personnel, and we do ask the patients to please wear a mask as well. We've always worn gloves for every exam. We do not wear gloves when we're talking to a patient, and you don't need to. I've told this to people as well. But we do wear gloves that when we're examining, and we're constantly changing our gloves. Our office is being cleaned and disinfected on a daily basis. So I think we're a pretty safe place to come. And more so now that we're doing the social distancing as per CDC guidelines.
Yeah, that's most important. Tell us a little bit about your office, because last time we talked, you had an office in Palm Springs. You were with a different organization. Tell us where you're at now and who you're with.
I work for the Institute for Women's Health and Body. It's a practice that's been in South Florida for about 23 years. And our office is not too far from my old office. It's about 4 miles. So I think I actually just tried to see. It's right next to JFK Hospital. So it's officially in Atlantis, Florida.
Okay, great to know. And so let's also talk about, so a lot of people during this pandemic, and we read a lot about this, everything ranging from different heart ailments and elective procedures, how it all kind of got, pushed on, to the side. And as we, tried to flatten the curve and, that's great and everything. But why shouldn't a woman or, anyone for that, in kind of that case, not postpone care? Like, there's a lot of people that may just start being to get out. You see your office is pretty open and has been, but what are some of the reasons people and women specifically shouldn't postpone care?
Well, women shouldn't postpone care especially when there's a problem. When somebody feels an abnormal lump, when they have pain, when they have an abnormal bleeding episode, the list goes on. When there are serious things, serious symptoms that people are experiencing, postponing care can make a difference in outcome. So we're encouraging people to come to the office with these type of serious problems. Now, screening is another story. If people feel comfortable coming to the office and comfortable with the social distancing, then we encourage them to get their screenings. If somebody is in a very high risk category, elderly, so forth, they certainly can wait a few months. When I say a few months, we don't mean years, but we would like people to feel comfortable going out of their homes before they come in for their screening appointments. So in other words, priority is symptoms. Second would be screening.
Okay, and that's goes as well as the wellness visit, as well as that like a once a year visit. I may be a little off in different the categories of primary care, but those are still available as well. obviously.
Oh yeah, we're definitely seeing people. We weren't up until recently, and now that we've told patients that call, yes, we'll see you for your screenings, more and more are coming in.
Okay, that's great to know. We're here with Dr. Natalie Sohn. Telehealth's available, offices are open, and that's one of the reasons we do this show, to kind of get the word out. We're gonna take a quick break. Dr. Sohn, just stay right there. We're gonna run a quick commercial, and on the other side, I got a few more questions for you on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. We're here with Dr. Natalie Sohn, Institute for Women's Health and Body in Atlantis, Florida. Dr. Sohn, what age range of patients do you treat? I think that's a good question, because I know it's a very large age range.
It's a huge age range. We see children sometimes have certain gynecological issues or congenital issues, and we see the very elderly centenarians we see. So I think the oldest patient I've seen was about 101, and the youngest, I did see a child that was about 3 years old one time, but everything in between.
Yeah, it's that is primary care right there. I mean, everything in between. So I noticed, and I don't know if this works in your specialty, but others as well. I always look for a board certified doctor, and I know you're one as a board certified OBGYN versus not board certified. I want to ask you, why is it important to see a board certified physician versus one that's not? And again, I don't know if that you can not be one as an OBGYN or not. I know with orthopedic surgery, sometimes you can find one that's not, but I just wanted to ask you that.
Well, board certification means that a board of doctors in our field that create a certain standard, have administered testing, and we have fulfilled requirements that allow us to obtain that certification. Now, there's only a few reasons that somebody wouldn't be board certified, and none of those reasons are something that most people would view as favorable. So in my opinion, you should always go to a board certified doctor. Then you can be certain that they have met a minimum and above standard. It's not a minimum, it's actually a high standard. So to be the practicing physician that you want them to be.
I see. So definitely look for that. Yeah, I just wanted to ask that. I know you're a board certified OBGYN. How long have you been practicing medicine here in South Florida?
Since 1997.
Oh, great.
So,
Yeah. So
23 years.
yeah, very experienced. And yeah, and right here in Palm Beach County, or were you, because I've known you since you've been in Palm Beach County, but maybe beforehand you were elsewhere or just in this area?
No, I've been in Palm Beach County since the beginning.
Oh, that's
I've been
great.
here.
Very
Yeah.
experienced right here in Palm Beach County. Um, Let me ask you, I didn't get to ask you this last time. Where did you complete your education and training to become a doctor?
Medical school was the State University of New York at Stony Brook, and the residency was at Long Island Jewish Medical Center, which is now called Northwell Health. Both are in. That's also in New York.
Okay, New York as well. Why did you decide to become a physician?
Gee, I don't know. When we're kids, people are always like, "Oh, what do you want to be when you grow up?" And I remember people saying, "Oh, I want to be a lawyer," or "I want to be a policeman or a fireman." I think that was when we were little kids. Policemen and firemen were the big ones. No, I want to be a baker. I had a friend, but I always said I want to be a doctor. And I actually, when I was in college, I had a medical condition myself. And I experienced, surgery and medical care for the first time. And I said, wow, I definitely could do this. I do want to be a doctor. Became, wow, let's try to get into medical school. And then it went on from there. So something my whole life I've always been interested in.
Yeah, and I watched a video with you, an interview with you recently, and you said, correct me if I'm wrong, but you originally wanted to do ER medicine or be an emergency room doctor, but as you did your rotations, you really liked the kind of connection you were making with the women patients and talking with them and taking the time with them, and you kind of said like, it's not only a little bit of, that's why I keep on saying primary care. I was watching that video today, and you could do primary care, and then you could also do surgery, and it was the full gamut for you. So if you could talk a little bit about that decision, because people go into, and I didn't realize this until I started interviewing doctors, because I didn't go through that whole path that you went through, but you don't go into medical school just, maybe some people do, but deciding on an exact specialty. It's something that evolves within you, and you decide really what your passion is, right? Is that how it works?
Yes. You start medical school sort of maybe having an idea of what you want to do. And then when you actually do your rotations, which is usually 2 or 3 months in each basic specialty, and then you eventually do subspecialties, or like ER medicine's more of a sub small specialty. You develop what you like and what you don't like. And when I did OBGYN, it was like being a jack of all trades for women. We do primary care, we do office medicine, surgery, obstetrics. We do a little of everything. And I loved it. And most people that go to medical school will tell you that when they did their rotation, it sort of clicked. Oh, this is great. This is what I want to do. My daughter just graduated medical school, and she had the same eureka moment. So not OBGYN, though, but she also experienced that.
Oh, congratulations. That's great to hear. She just graduated.
Thank
Congratulations on that. Yeah, and so we're here with Dr. Natalie Sohn. Again, it's the Institute for Women's Health and Body in Atlantis, Florida. I have the phone number here, 561-965-2665. And so we have a couple extra minutes, and I got a couple more questions on my list, but I just wanted to share with the viewers and listeners also, because I did last time. I got to know Dr. Sohn working with her, but as well as I always share news about Daisy on this show. So Dr. Sohn delivered my daughter Daisy, and Daisy's going to be 3 years old on June 29th, so she's getting there. Yeah, yeah. Well, I'll have to send you a picture. She is very tall, and we're so happy with the care you provided my wife. They're actually taking the bath in the hall in the bathroom there with my wife's in there, so she wanted to say hi as well. But I can attest that Dr. Sohn is a very thorough, fantastic, experienced doctor. As you go through that process, you go to the office a lot. I didn't know that. That was something that opened my eyes. I kind of just sat and was quiet, but Dr. Sohn was nice enough to let me in there, and that put me at ease a lot. Going through that process, because this was the first process for both of us. But I didn't get to say that last time when you were on the show because we were kind of rushed. We were at a different location, but I can attest to the great care Dr. Sohn provides for the OB care. So I just wanted to throw that out there as well and say thank you again. And my wife wanted to make sure that she got to say hello.
Oh, that's great. Daisy's 3. That's wow.
Yeah,
time goes
almost.
quick. Enjoy them while they're small. That's the most adorable age. 3, 4, 5. I remember that.
Yeah, so, it really is, and it's been great. So I just have one other question. I'll share your info again at the end, but I always like to ask this when I have doctors on the show. I've been doing this show for almost 5 years, but one of my favorite questions: what are your hobbies and passions in life outside of medicine?
Oh, we never have enough time to do our hobbies and passions. But as I get older, I see that it is important to make the time. I go fishing with my husband. My husband is a big boater and fisherman. And we go fishing, and sometimes we actually catch something, which is nice. And we go down and we dive. And we always dive for food. That's what we fish for. We fish for food that we keep. And I also like cross stitch, which is a needlework type of thing. So those are what I do on my day off.
Really, that's neat. I can definitely relate. I can definitely relate to the fishing. I grew up in Jupiter, and boy, there's been some pretty good fishing before this storm came through. Did you have a chance to get out and enjoy it?
We did. We got some grouper and some tilefish, and it has not been good fishing weather all week. I think the seas have been 4, 5, 6, 7 feet, something like that, and that's not for me. And I don't think my husband likes it either. But yeah, we went. Yeah. Having everything closed down, the boat ramps were closed down, so there weren't a lot of people going fishing. And I think over a month or two, the fisheries actually rejuvenated a little bit because there seemed to be more fish.
That is a good point.
Amazing.
That is great. Well, I want to thank you again so much for joining me. I mean, this is a great interview, and we got to learn a little bit more about where you're at in your practice. Again, it's Dr. Natalie Sohn with the Institute for Women's Health and Body, 561-965-2665. Dr. Sohn, thanks again, and we'll see you next time.
Thanks for having me.
Appreciate it. We'll see you next time on the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having